There are thousands of people on Vancouver Island and across BC in healthcare limbo tonight. They're wondering if their CT scans were misread and if their condition has been misdiagnosed. Scans that were interpreted by radiologists in Comox, Powell River and in Abbotsford are now being reviewed. The investigation comes in the wake of claims that 3 doctors may have inadvertently and incorrectly interpreted CT scans, leading to the misdiagnoses of several health problems. A woman in the Comox Valley says she was the victim of such a misdiagnosis, but when she tried to report it and have someone investigate, she was ignored. A News reporter Gord Kurbis has her story.
She's a woman who keeps meticulous records about everyone she's corresponded with over the past few years. That's because Cumberland's Yvonne Kafka has not only been battling cancer, but also the Comox Valley's medical system.
There's a flaw in your system. Ask me. Ask me, the patient. I've been through it. I've been through the holes. I'll tell you where all the flaws are.
Despite being given a clean bill of health twice through mammograms and then an ultrasound at St. Joseph's Hospital, Kafka still knew something was wrong. She then had to fight to get a biopsy.
And the surgeon said, well, where am I going to poke? I don't know where to poke. I said, I'll show you where to poke, and I showed him where to poke.
Because you felt something? Or
Yes, I could feel it. And 3 weeks later, full-blown cancer.
And Kafka says the misdiagnosis she received is not unique. She's heard from others with similar stories who are afraid to come forward. She's glad the problem is now becoming public.
When I found out, I said, there is a God, because I pray about this every day. For some people, it might be too late, but not for everybody. Some people might just be at the beginning of their race.
And now that the issue is in front of the public and the politicians of Victoria are pointing the finger at who knew what and when, Kafka says a lot of people should have known because she was raising the issue back in 2008. The only problem was no one seemed to want to do anything about it. Kafka showed a news letter she wrote to the hospital, the Vancouver Island Health Authority, then Health Minister George Abbott, even the NDP's Carol James. The issue didn't get much attention back then.
And I followed protocol. And the protocol was when I phoned the hospital, there was no advocate to help me out, like a patient advocate to say your complaint. They didn't have anybody.
Asked about her case today, St. Joseph's CEO Michael Pontus says any patient having concerns about their scans should talk with their physicians. He also clarified the problem that came to light with a hospital radiologist yesterday. He says only 7 scans showed a problem centering on a short period from January of this year.
It was brought to our attention that this was a quality issue. Immediately, we took the steps to remove the person from reading those scans into the future as a preemptive quality measure, and then began to look back to see, is this a short-term interim? Is this a longer term? How far back should we go?
Pontus says the hospital will be working with the Vancouver Island Health Authority to sort through the problems. Reached today at his home, the physician in question didn't want to make any comment. He's now on a leave of absence. In Comox, Gord Kurbis, A News.
Health Services Minister Colin Hansen has ordered a review of radiologists' credentials and training in BC, but stops short of taking responsibility for the problems. He says it is up to the College of Physicians and Surgeons to decide which doctors are qualified to practice in BC, and that the review that is now underway is likely going to result in stricter guidelines.
We have a very good relationship with the College of Physicians and Surgeons. The radiologists have a very active section of their own association within the BC Medical Association, and I think that the events of this last week, the events that come to light in this last week, I think point to the fact that we have to look at how we can do things differently in the future. So I will be looking for Dr. Cochran's advice in that.
Hansen says there are a number of qualified trained radiologists practicing in the Comox Valley, and patients on the Mid and North Island can feel confident in the care they are continuing to receive.